Obviously the 6 C's, the main foremost is care and compassion. Without the care and compassion, I would suggest we would not be able to deliver person-centered care, and you tend to build up a relationship with the patient, not only with the patient but also with the families as well, and the empathy that you need to build up is foremost, because you have to step into the shoes of the patient and then go through it, like how the patient and the families actually they bear it. So it gives you a lot of things, and it is also a personal, like a character of a person, how you can build that up. So care and compassion is very important for nursing course.
I think I'll choose compassion. I've seen compassion in action every shift that I'm on. One example is when a gentleman was receiving end-of-life care and he passed away, and his wife was present with him and she didn't want to be left alone, so I just sat with her and held her hand and listened to tales of his life and what they'd enjoyed together, and made her a cup of tea, and generally just to be there for her.
I think compassion is my biggest one. I don't think you can do this job without being a compassionate person. When you're looking after really poorly children, and if you can't have an understanding of how their family members must be feeling or how the child must be feeling, then you won't do a brilliant job, I don't think, and you need that to make them feel at ease and feel confident in your abilities to care for them.
Plenty of feedback. In our PAD document, so practice assessment document, there's a part on the document where service users or patients' family members can actually leave their feedback on the care that they've received from you. Aside from this, I've had a couple of cards and a nomination for an eye care award within the university, which was based on patient feedback. So
it was an elective surgery for a patient. So starting from like the assessment unit where the patient comes into for the surgery, they go through an assessment. Then after that, they have to go for an operation. Before the operation, they had to go through the anesthetic, the operation, and then the recovery. So I actually followed the pathway which the patient follows during the time they spend in the hospital. And at the end, the patient was so good, like so happy. Then they sent me a thank you card, especially to me and also the team.
On the neonatal unit, I cared for a baby. He was born very prematurely, and I was able to care for him from being born, seeing him in intensive care, right through to being in special care. And on finishing my placement, I was given a thank you card from his parents for the work I did, and it made me feel really positive about the support that I'd given them, and yeah, quite proud.